Okay, welcome back to the channel. So today we are having a quiz on the thorax under gross anatomy. So we have 10 exam standard questions that can make you be ready for your exam. Okay, so let's begin. Question 1. Which statement best defines the thorax in human anatomy? Which statement best defines the thorax in human anatomy? A. Region between the skull and neck. B. Region between the neck and diaphragm. C. Region between the diaphragm and pelvis. D. Region containing only the lungs and heart. You have 5 seconds. Okay, so the correct answer is B, the region between the neck and diaphragm. Thoracic region is the anatomical region located between the neck and the diaphragm inferiorly. Okay, looking at the diagram, the highlighted area in sky blue represents the thoracic region. Okay, the diaphragm forms the lower boundary of the thorax and separates the thoracic cavity from the abdominal cavity. Okay, then the thorax contains important structures including the lungs, heart, major blood vessels, and other organs within the medial sternum. Okay, then why other options are wrong? Option A is incorrect because the region between the skull and neck is the head and neck region, not the thorax. Okay? Option C is incorrect because the area between the diaphragm and pelvis belongs mainly to the abdomen and the pelvis. Okay? Then also option D is incorrect because the thorax contains more than just the lungs and heart. It also contains vessels, nerves, lymphatics, the esophagus, and other structures. Okay? Then here is an exam tip. Remember this simple definition. The thorax is the chest region between the neck and the diaphragm. Okay? Then the diaphragm is the key landmark that separates the thorax and the abdomen. Okay? Alright. Let's go to question 2. Question 2 reads, which anatomical landmark marks the junction between the manubrium and the body of the sternum? Which anatomical landmark marks the junction between the manubrium and the body of the sternum? A. Xiphsternal joint. B. Suprasternal notch. C. Sternal angle. D. Costal margin. You have 5 seconds. Okay, so the correct answer is C, sternal angle. The sternal angle, also called the angle of Lewis, is the junction between the manubrium and the body of the sternum. Okay? In the diagram, the upper part of the sternum is the manubrium, and below it is the body of the sternum. Okay? Then the point where these two parts meet forms the sternal angle. Okay? This landmark is clinically important because the second rib attaches at this level, making it useful when counting ribs and identifying intercostal spaces. Okay? Then why other options are wrong? So option A, the Xiphsternal joint, is incorrect because it is the junction between the body of the sternum and the xiphoid process, located lower down. Okay? Option B, the suprasternal notch, is also incorrect because it is the depression at the superior border of the manubrium between the clavicles. Okay? Then option D, the costal margin, is also incorrect because it is the lower border of the thoracic cage, formed mainly by the costal cartilages of the lower ribs. Okay? So here is an exam tip. Remember, the sternal angle is the landmark for the second rib. When locating ribs clinically, always start by finding the sternal angle. The sternal angle has three names: the sternal angle and angle of Lewis. So I want you in the comment section to comment the third name by which we call the sternal angle. Alright, let's go now to question 3. Question 3 reads, which surface landmark is commonly used clinically to locate the cardiac apex beat? Which surface landmark is commonly used clinically to locate the cardiac apex beat? A. Right nipple line. B. Left fifth intercostal space in the middle clavicular line. C. Sternal angle. D. Suprasternal notch. You have 5 seconds. Okay, so the correct answer is B. Left fifth intercostal space in the middle clavicular line. Okay? The cardiac apex beat is normally felt on the left side of the chest, at the level of the fifth intercostal space, along the middle clavicular line. Okay? Looking at the diagram, the vertical line represents the middle clavicular line, and the highlighted area with a red spot represents the fifth space between the ribs where the apex beat can be palpated. Okay? This is an important surface landmark used during cardiovascular examination. Why other options are incorrect? Option A is incorrect because the cardiac apex is not located on the right side of the chest. Okay? Option C is also incorrect because the sternal angle is a landmark for identifying the second rib and counting intercostal spaces, not locating the apex beat. Okay? Then also option D is incorrect because the suprasternal notch is a landmark at the upper border of the sternum between the clavicles. Okay? Here is an exam tip. Remember the cardiac apex beat location using this rule. Apex is equal to fifth intercostal space, left side, middle clavicular line. Okay? Alright. Let's go to question 4. Question 4 reads, which structure forms the posterior boundary of the thoracic cage? Which structure forms the posterior boundary of the thoracic cage? A. Sternum. B. 12 pairs of ribs. C. 12 thoracic vertebrae and intervertebral discs. D. Costal cartilages. Take 5 seconds to choose your answer. The correct answer is C, 12 thoracic vertebrae and intervertebral discs. The thoracic cage has several boundaries. Looking at the diagram, the structure at the back of the thorax are the 12 thoracic vertebrae, labeled T1 to T12, okay? Together with the intervertebral disc between them. These structures form the posterior wall of the thoracic cage and provide attachment points for the ribs, okay? Why other options are incorrect? Option A is incorrect because the sternum forms the anterior boundary of the thoracic cage, located at the front of the chest. Option B is incorrect because the ribs form the lateral boundaries of the thoracic cage, not the posterior boundary. Option D is incorrect because costal cartilages connects ribs to the sternum and contribute mainly to the anterior chest wall. Exam tip: remember the thoracic cage boundaries. Anterior or the front is the sternum. Lateral or the sides is the ribs and costal cartilages. Posterior or the back is the thoracic vertebrae, labeled T1 to T12. Okay, let's go to question 5. Question 5 reads, which group of ribs attaches directly to the sternum through their own costal cartilages? Which group of ribs attaches directly to the sternum through their own costal cartilages? A, true ribs. B, false ribs. C, floating ribs. D, atypical ribs. You have 5 seconds. Okay, the correct answer is A, true ribs. The true ribs are the first 7 pairs of ribs. Looking at the diagram, ribs 1 to 7 connect directly to the sternum through their own individual costal cartilages. This direct attachment is what distinguishes true ribs from false and floating ribs. Why other options are incorrect? Option B is incorrect because false ribs, which are ribs 8 to 10, do not attach directly to the sternum. They attach indirectly through the costal cartilage of the rib above. Okay? Option C is incorrect because floating ribs, ribs 11 and 12, have no anterior attachment to the sternum. Okay? Then also option D is incorrect because atypical ribs describe ribs with unusual anatomical features, not their attachment patterns. Here is an exam tip. Remember the rib classification: 7 true ribs, 3 false ribs, and 2 floating ribs. The easiest memory aid is 7, 3, 2. Okay? Let us summarize what we have covered so far. The thorax is the region between the neck and the diaphragm. The thoracic cage is formed anteriorly by the sternum, posteriorly by the 12 thoracic vertebrae and intervertebral discs, and laterally by the ribs and costal cartilages. Remember the rib classification: 7 true ribs, 3 false ribs, and 2 floating ribs. These are important basic landmarks for understanding thoracic anatomy. Alright, let's go to question 6. Question 6 reads, which muscle is the primary muscle responsible for elevating the ribs during quiet inspiration? Which muscle is the primary muscle responsible for elevating the ribs during quiet inspiration? A. Internal intercostal muscle. B. External intercostal muscle. C. Transversus thoracis muscle. D. Pectoralis minor muscle. Take 5 seconds to choose your answer. The correct answer is B. External intercostal muscle. The external intercostal muscles are the many muscles of the thoracic wall that assist with quiet inspiration. Okay? Looking at the diagram, these muscles are located between adjacent ribs. Okay? When they contract, they pull the ribs upward and outward, increasing the volume of the thoracic cavity and allowing the air to enter the lungs. Okay? Why other options are incorrect? Option A is incorrect because the internal intercostal muscles mainly assist with forced expiration by depressing the ribs. Option C is incorrect because the transversus thoracis muscle helps stabilize and depress the costal cartilages rather than elevating the ribs during inspiration. Okay? And option D is incorrect because the pectoralis minor muscle is an accessory muscle that can assist breathing when the upper limb is fixed, but it is not the main muscle for quiet inspiration. Okay? Exam tip. Remember, external intercostal elevates the ribs during inspiration. A memory aid is external muscles help expand the chest. Okay? Let's go to question 7. Question 7 reads, which part of the sternum articulates directly with the clavicles? Which part of the sternum articulates directly with the clavicles? A. Body of the sternum. B. Xiphoid process. C. Manubrium. D. Sternal angle. You have 5 seconds. The correct answer is C. Manubrium. The sternum consists of 3 parts. Okay? The manubrium, the body, and the xiphoid process. Looking at the diagram, the manubrium is the uppermost part of the sternum. On each side of the manubrium are the clavicular notches, okay, where the right and left clavicles articulate to form the sternoclavicular joints, okay. These joints are the only bony connections between the upper limbs and the exoskeleton, making them clinically important, okay. Why other options are incorrect? Option A is incorrect because the body of the sternum mainly articulates with the costal cartilages of the true ribs. Okay? Then also option B is incorrect because the xiphoid process is the smallest and most inferior part of the sternum. It serves as an attachment site for the diaphragm and some abdominal muscles. Okay? Then also, option D is incorrect because the sternal angle is not a separate part of the sternum. It is the junction between the manubrium and the body of the sternum. Okay? Here is an exam tip. Remember the three parts of the sternum in order from the top to the bottom: manubrium, body, and xiphoid process. Also remember that the clavicles articulate only with the manubrium, making it an important anatomical landmark. Okay? Let's go to question 8. Question 8 reads, which structure passes through the diaphragm at the caval opening located at vertebral level T8? Which structure passes through the diaphragm at the caval opening located at vertebral level T8? A. Descending aorta. B. Esophagus. C. Inferior vena cava. D. Thoracic duct. You have 5 seconds. Okay, the correct answer is C. Inferior vena cava. The diaphragm has 3 major openings that allow important structures to pass between the thorax and the abdomen. Looking at the diagram, the caval opening is located at the T8 vertebral level. Okay? It transmits the inferior vena cava, which carries deoxygenated blood from the lower part of the body to the heart. Okay? The other 2 important openings are the esophageal hiatus at T10, which allows the esophagus to pass through, and the aortic hiatus at T12, through which the descending aorta and thoracic duct pass. Okay? Why other options are incorrect? Option A is incorrect because the descending aorta passes through the aortic hiatus at T12, not the caval opening. Okay? And also option B is incorrect because the esophagus passes through the esophageal hiatus at T12. Okay? And finally, option D is also incorrect because the thoracic duct accompanies the descending aorta through the aortic hiatus at T12, not at the caval opening. Okay? Here is an exam tip. Memorize the diaphragm openings with the mnemonic: I ate 10 eggs at 12. It stands for inferior vena cava at T8, esophagus at T10, and aorta at T12. This is one of the most frequently tested anatomy facts. Okay? Let's go to question 9. Question 9 reads, which part of the pleura is directly attached to the surface of the lungs? Which part of the pleura is directly attached to the surface of the lungs? A. Costal pleura. B. Mediastinal pleura. C. Cervical pleura. D. Visceral pleura. You have 5 seconds. Okay, the correct answer is D. Visceral pleura. The pleura is a double-layered surface membrane that surrounds each lung. Okay? Looking at the diagram, the visceral pleura is the thin layer that is firmly attached to the surface of the lungs, following every fissure. Okay? The parietal pleura forms the outer layer and lines the inner surface of the thoracic cavity. Between these two layers is the pleural cavity, a potential space containing a small amount of lubricants that allows smooth movement of lungs during breathing. Okay? Why other options are incorrect? Option A is incorrect because the costal pleura is the part of the parietal pleura that lines the inner surface of the ribs and the intercostal spaces. Okay? Then option B is also incorrect because the mediastinal pleura covers the lateral surface of the mediastinum rather than the lungs. Okay? Also, option C is incorrect because the cervical pleura, also called the pleura capula, extends into the root of the neck above the first rib and does not directly cover the lung surface. Okay? Here is an exam tip. Remember this simple rule. Visceral pleura is stuck to the lungs, while parietal pleura lines the thoracic cavity. If you remember V is equal to visit the lungs, you will quickly identify the correct pleural layer in exams. Okay? Let's go to question 10. Question 10 reads, which statement correctly describes the lobes of the human lungs? Which statement correctly describes the lobes of the human lungs? A. Both lungs have 3 lobes. B. The right lung has 3 lobes and the left lung has 2 lobes. C. The right lung has 2 lobes while the left lung has 3 lobes. D. Both lungs have 2 lobes. You have 5 seconds. Okay, the correct answer is B. The right lung has 3 lobes while the left lung has 2 lobes. The 2 lungs are not identical. Okay? Looking at the diagram, the right lung is divided into 3 lobes: the superior, middle, and inferior lobes. These are separated by the horizontal and oblique fissures. Okay? Then the left lung has 2 lobes, the superior and inferior lobes, separated by a single oblique fissure. The left lung has a cardiac notch, which provides space for the heart, making it smaller than the right lung. Okay? Why other options are incorrect? Option A is incorrect because only the right lung has 3 lobes. Okay? Option C is incorrect because it reverses the correct arrangement of the lung lobes. Okay? And also option D is incorrect because the right lung has 3 lobes, not 2. Okay? Here is an exam tip. Remember, right equals 3, left equals 2. The left lung has 1 fewer lobe because it accommodates the heart with its cardiac notch. Okay? This is one of the most tested facts in thoracic anatomy. Okay? So we have completed part 1 of our thoracic quiz. In this section, we have covered the definition and boundaries of the thorax, the thoracic cage, rib classification, the external intercostal muscles, the parts of the sternum, the major opening of the diaphragm, the pleural layers, and the basic anatomy of the lungs. Take a moment to review these key concepts as they form the foundation for understanding thoracic anatomy. In part 2, we will continue with the mediastinum, heart, coronary circulation, and the great vessels of the thorax. See you in part 2.